PMS is premenstrual syndrome, and we don't have an exact cause for it, but if you look at the symptoms and when they're occurring, it has to do with your menstrual cycle. Normally after ovulation, usually getting worse about 7 days before your period. And it manifests itself in many different kinds of symptoms. Some women will be more emotional, meaning they'll cry at commercials. Some women will get headaches, and there are those that like to pick fights during that time. They notice that a week or so to 10 days prior to their menstrual cycle that they're having an adverse effect on their relationship, or their children are tending to want to avoid mom because she's either yelling at them, or she's crying, or she's lost patience and can't work on things with them. And the other side to that would be that your workers and possibly your boss or someone has told you that, you seem to be fairly even keel, and then all of a sudden, kind of once a month, you have your head spin and you're much grouchier and you're much harder to work with. Women in their 20s and 30s, because of all the other outside pressures that you have, they're usually young families, they're trying to work, you have a woman that's trying to do everything, and so I think sometimes the symptoms are much more difficult for them to cope with. The advice that I would give women that are experiencing PMS or think they're experiencing PMS, first thing is when you look at women that tend to be a little bit more moderate in their diet and what they're drinking and eating, along with lots of exercise, does help. I'm a firm believer that the B-complex vitamins truly do help. Increasing your exercise, obviously more fruits and vegetables, a more healthy lifestyle. And I think sticking with more lean meats and not the fried types of thing and not the rich sauces, all those types of things tend to contribute to some of your symptoms. When you get towards your 40s, your 50s, and your menstrual cycle is changing, oftentimes you find that the PMS symptoms actually improve.